inspired you or motivated you with this transformation effort that you recently underwent?
Similarly, for Jurong Health, we had a vision and a mission. Our vision and mission was to transform healthcare, empower patients, and bring health to every home. So that was where we started from.
I was wondering if you would share how the leadership in your hospital, how they supported you to really ensure success.
I think leadership is important for two things, at least for how we saw it. The first critical thing that they did was to hold that vision and mission central in all that we did for all 3,000 staff, from the time of procurement to the time of implementation, go live, and even post-live optimization. The second thing they did was to make sure that they have accountability for the project, because we did have to get buy-in from our sponsors, from the board, from the ministry, to ensure go ahead for the project. So they had to do their homework to make sure that the project is balanced in terms of the cost, that we don't go over our timeline, and that they keep things on the keel, and they are accountable to the system, to the payers, to the users.
I have a question about some of the challenges that you encountered. So what was one main challenge that you encountered in implementing this solution, and how did you overcome it?
So one of the key challenges we face are uncertainties, because we are introducing many new things like new technology, new work processes, definitely a new physical hospital we are building, and also a new team. So how we overcame all this is we conduct diligent review. We also conducted many different rounds of testings, about 6 months of intensive testings, and of course training to train up the 3,000 users. One of the critical success factors is we spend time to develop test scripts to incorporate patient scenarios, so that when patient pass from one care team to another, we also tested that to make sure that the people will be ready to use the system and the technology when we open the hospital on day one.
What kinds of advice or motivation would you give to other hospitals to start a transformation journey like this with information technology?
I think firstly, we need to have leaders that are visionary, that are believing, that are also supportive. They need to create an environment for the team to be able to work in. And then secondly, because as I've said, this is a 6 years journey, we need to remain focused, stay focused on where we want to go, and also to keep the momentum or maintain the motivation of the team. So we have to help to pace and prioritize the tasks as we go along.
And I was wondering if you could share with us some of the first. We'll go to Jennifer there at the end.
Yeah, we do achieve many firsts in Singapore. Okay, we are the first one implement the integrated EMR using Epic in Asia Pacific region. Okay, which comprised 12 key modules, which host the clinical, auxiliary, and administrative systems. Okay, we also have the first one implement the enterprise-wide real-time location system in public hospital, which track both patient and critical assets. So we improve the staff productivity.
So those many outcomes of firsts are clearly while you're sitting here this evening. So really want to congratulate you on being a winner and look forward to seeing you for the rest of HIMSS.
Thank you, Michelle.
Thank you.
Thank you.
Thank you.